Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Hi, I'm Dr. Matthew Cave at the University of Louisville in the Department of Medicine. So today we had an internal medicine grand rounds by Dr. Kimberly Brown from Henry Ford on portal hypertension. Dr. Brown, could you please provide us with a brief summary of your talk today?
Thank you, Dr. Cave. So the new things in portal hypertension, I think, revolve around our ability now to diagnose portal hypertension in the absence of endoscopic features, but also our renewed understanding that we can alter outcomes for patients who have early portal hypertension in terms of a reduction in the progression. And with reduction in progression through the use of beta blockers in particular, we can alter outcomes in terms of decompensation, events such as variceal bleeding, ascites, encephalopathy, but also in terms of overall survival. So I think our change has really been toward non-invasive measurement and documentation of portal hypertension in patients in a non-invasive way and how we can best affect them moving forward.
Fantastic. Thank you.